president outlined it last night, again today. Republican Governor Pawlenty of Minnesota says not quite. So, Governor, you're not buying it. This would just be the rich paying for this.
Well, Neil, this whole health care proposal by President Obama is really quite a joke on a number of levels. I think he is scamming the American people. And just on this payment issue alone, even if you believe that he's only going to tax people over $1 million, which I don't think is true, what's going to happen is he's proposing it is that's only going to cover about a third or 25% of the total cost of the package. The rest of it is going to be paid for, quote unquote, by saving waste, fraud, and abuse. And if you believe that, then I've got some January tea time for you in northern Minnesota. That's not going to happen. He's going to try to contain costs in health care by expanding eligibility, by expanding programs, by expanding government intervention. It's not going to work. The costs of this are going to worsen our debt, our deficit, our interest rates, and the overall financial burdens on all Americans, not just wealthy Americans.
By the way, I assume it would not be wise to find January tea times in Minnesota. Okay.
You're a wise guy. You're quick. You're a quick study.
Let me then get your sense of what Republicans do with this, because you might have heard Senator Jim DeMint earlier on. He's been targeted for trying to play politics with this, or that's a charge from the president, without ever mentioning him by name, but sort of mentioning his strategy on this and calling this sort of like a Waterloo moment for the president and an opportunity then for Republicans. Republicans have to be very careful on this, do they not?
Well, you got to be a little careful, because if President Obama goes to the Democrats, who otherwise would be opposed to this bill, and say, look, the Republicans are making this political, now it's a referendum on me personally, Barack Obama, and I need you to be with me, otherwise they're going to break our, political wall of protection, then it becomes a political battle. I think we can defeat this on the merits. It's such a bad bill. It is. The American people have figured this out, that it's bad, that it is a scam being perpetuated by President Obama and the Democratic-controlled Congress, that it will fall of its own weight. But what we have to be careful of is not allowing him to then make it a political referendum on him and get the Democrats to all rally around him because it's, his rise or fall. I think that would be something we got to be careful about.
Do you think, Governor, though, that let's say this does fail and Americans are faced, as they have been, with ever higher premiums and sometimes in some cruel and selective care and costly care at that, depending on the policy you have, that it's going to boomerang on Republicans, that here was a chance for more folks to be covered, for more of these onerous costs to be, and you're maybe quite right on some of the problems with this health care package, but it was an attempt to fix some of that you would be arguing after the fact, and people would be saying, those Republicans, they stopped all this, and we're
well, there's no question that we need health care reform, and there's good examples at the state level, including in Minnesota, on how to do that. So this isn't a debate about whether we should reform it or not, but it's a debate about how to best do that. The central premise behind President Obama's proposal is that we are going to lower costs by expanding programs, expanding coverage, expanding eligibility, and having the government take parts of this over, and that is a fundamentally flawed premise. It isn't going to work. And what they argue, Neil, in short, is by insuring people, then they won't show up uninsured and we'll have to pay for it. That's called cost shifting. In other words, the uninsured are paid for, invisibly through all of our premiums right now. But the closest track record we have of a program like this is in Massachusetts. And yes, they expanded coverage, but the cost of that thing has nearly tripled in just 36 months, and now they're even looking for an additional federal bailout. It has not been successful at containing costs. In fact, it has quadrupled nearly in costs since they started it.
All right. Now, the president has long argued, he was echoing it today in Ohio, that more people are with me than with Republicans. There was this small protest outside his event today. I think we have some video of that. But this is more, I guess his people say, the exception than the rule, that Americans are with him and not with you in particular, Governor, but you got my point. What do you make of that he has got Main Street behind him?
Well, I don't agree with that. Recent polling shows that Americans are split on his proposal. Of course, Americans want health care reform, but that shouldn't be confused with Americans saying we want the government to take this over, and to have him say we're going to have a government program to compete with the private sector, to keep the private sector honest. Well, what's next then? If you don't like the toilet paper prices and the toothpaste prices at Target, are we going to have a government Target or Walmart to compete to keep those retailers honest? And you can go down the line with that example. We need patient-centered consumer-centered health care. There are ways to do that. Again, we've done it in Minnesota with our state employee plan and others where the premiums have been 0% increases in many of the last several years. He's going about it the wrong way. The Republicans should be talking about the better way to do it, but it's not accurate to say the American people are with him on this issue. At best, it's a split, and when they learn about his proposal, then they're with us.
Governor, my memory serves right, you were just in Iraq, right?
I just got back last night from nearly a week in Iraq, Afghanistan, and visiting wounded soldiers in Germany at a hospital.
How are things looking there? I know the attention seems to have shifted to Afghanistan, but we've almost forgotten Iraq. But where do things stand there?
Well, since the peak of the insurgency in 06 and 07, Neil, the security incidents and acts of violence are very low now compared to then, but it's still a very dangerous place. But the security situation in Iraq is greatly improved since the surge and the Sons of Iraq came on our side and helped join us. Now, the real question going forward will be, can the Iraqis get up on their feet and avoid some of the political pitfalls of ethnic strife and religious strife, but from a security standpoint, it's greatly, greatly improved.
If they can't real quickly, Governor, and they botch it and they're overrun or it leads to outright civil war in the country, are we done there?
Well, you look at our interests in the region, Neil, particularly as it relates to Iran and the possibility of them obtaining a nuclear weapon. The president has said he wants all combat troops out of Iraq by 2011. I don't like those arbitrary deadlines. I do think we should draw down the troops and get them out of there, but we should do it when it's secure and stable. We've got too much blood, too many lives that have been lost, too much treasure that's been expended to just pull out of there and let that fall. We should stay until we can get it stabilized and they can stand on their own 2 feet.
Governor Pawlenty, thank you. Very good seeing you again.
Good to see you, Neil.
All right.